think patients have lots of hurdles to overcome. I think the biggest single thing they have to overcome is we hear that C word and we stop. And it sometimes paralyzes us. And breast cancer is treatable. And we have to remember that. We have to remember that breast cancer is a treatable disease. And we're very successful at treating it. And so I think the biggest hurdle people have to do is they have to stop, take a breath, realize that cancer, breast cancer, doesn't mean that the end is imminent. And then start to listen and absorb the information and then try to process it as best as they can. Renae specifically was going to always be successful because Renae is an upbeat patient. She's easy for me to take care of. Every time I see her, it's like opening a Christmas present and getting to see something new and glorious that's inside of it and be surprised. I think Renae had such a great attitude and the fortitude to carry through the whole process. It actually made my job easier. I think the role of breast reconstruction surgery is to provide as much normalcy as possible. It's not to make you better. It's not to torture you, obviously. It's to go ahead and have you have your cancer treated and then get you back to as close to normal as we can possibly get you. Most of the time when we see a patient for breast cancer, there are two distinct points that we might see them at. One is before any therapy has happened. In other words, before any surgeries have occurred. So a lot of people will see us after they've seen the general surgeon, and the general surgeon has said, you might consider doing immediate breast reconstruction. Immediate breast reconstruction means doing it at the time of the general surgeon taking the breast cancer out and the plastic surgeon coming in at the same time and potentially saving one whole surgery and putting an implant in or doing some other form of breast reconstruction that will go ahead and complete it perhaps in one less surgery overall. A second time is to go ahead and do breast reconstruction after the cancer surgery has been done. So you might have seen the surgeon, had the cancer surgery done where you remove the breast cancer and potentially either part or all of the breast, and now you're coming back in at a later date to have the plastic surgeon reconstruct that breast and make it back as close to normal as we can. When I first see a patient, and especially if it's that initial visit and they're really upset about just being told they have breast cancer, one of the things I like to do is think about what would I like? What would I like for me, or what would I like for my wife if we had some bad news similar? And so what I do is I try to reassure them that they should take a deep breath. There are people looking out for them. I'm one of those people, and I'm going to help them get through this. There's lots of people involved. There's oncologists, there's their primary care physician, there's oncology nurses, radiation oncologists, a general surgeon, and hopefully me. And hopefully what we can do is together get them on that path to healing and on that path back to being normal and looking normal when they get out of the shower and look at themselves again. Plastic surgeons kind of get a bad name. We see everything on TV, and everything we see on TV is almost always cosmetic surgery or aesthetic surgery related. We do a lot of reconstruction here, not just breast reconstruction, reconstruction after motor vehicle accidents and traumas and other forms of cancer, birth defects, things like that. I do approximately 65% cosmetic surgery and about 35% reconstructive surgery. The one thing I'll tell you is I think doing the reconstructive surgery makes me a better cosmetic surgeon. Reconstructive surgery is very difficult. It's demanding. It requires you being on your game all the time and making sure that you actually use your imagination at times to do things that you may have never actually even done in your life. But you're taking a piece from here and a piece from here and you're saying, in this unique situation, we have to pull those together. I think that makes you a better cosmetic surgeon because it makes you comfortable doing kind of, not the mundane and routine things, but things that we are more comfortable with. It is kind of a mix of creativity and a mix of the science that you were given when you went through residency, bringing those two things together to make a unique situation. The amount of people that go through breast reconstruction right now versus years ago is changing. The data suggests that more and more people are going through breast reconstruction as they're given a diagnosis for breast cancer. I would tell you that I've been in practice for over 20 years now. When I first started in practice here in northern Michigan, not all the women did breast reconstruction, fewer did than now, and the ones that did breast reconstruction didn't do immediate reconstruction. I think the changes over the 20 years have been kind of exciting, because what we're doing is we're looking at more and more women having breast reconstruction. And as these women are having breast reconstruction, more and more of them having it early on, immediately, and trying to save a whole surgery or multiple other surgeries later on down the road. I think there's a country song that says, "Live every day like you are dying," or something like that. It seems kind of morbid to say that, but I think the unintended benefits of going through this and getting to the end and saying, wow, I actually look pretty normal, and I've gone through this big, ugly process, I think sometimes it makes them live life a little brighter afterwards. On top of that, you meet a lot of people. You show a lot of people things you wouldn't show other people, and you get close to a lot of other professionals and paraprofessionals. I like it because some of our breast cancer patients have become friends with our nurses, our medical assistants, our receptionists. We know them all. We see them in Myers. We see them out when we're shopping. I think that's glorious. I think here at the Center for Plastic Surgery of Northern Michigan, one of the things that's not just about me, but the whole practices, is that we view it as a process, and as a process we're going to help you get through. We're going to take you through it together. On top of that, we have a lot of expertise. We are uniquely poised because we do all forms of breast reconstruction. Some plastic surgeons don't do all the various techniques for breast reconstruction. We do. Between our young guys like Dr. Jeffries, who do these big, gigantic, fantastic surgeries that involve hours and hours of surgery, to sometimes even the simplest things like a little bit of fat grafting just to take a little contour defect out. We do it all. And I think we do it all with compassion. So I think that's the most important thing.